Personally.
Dawa hajameza, nataka ameze.
Na anakula vizuri?
Kula nakula.
Mama.
Okay, sawa. Mama. Leta mkono.
Sasa kidogo nina confused. Sasa nimuitishe ile kitabu.
During our visits, we train the relative who's willing to become the primary caregiver on how to go about the patient's lives, like taking vital signs, that is blood pressure, temperature, and pulse. We also advise them about the diet and what to look out for in the patient, like signs and symptoms of anything that might be serious and needs urgent medical attention.
Okay. Okay. 4. Amesha kunywa breakfast? Hiyo iko sawa. 4 iko.
I've been taking mom to various hospitals, but I found they've been very expensive for me. I couldn't afford. So I talked to my boss about my mom, and she introduced me to Care. So Care has been very supportive, helpful to me, because they brought me nurses from the hospital to train me to look after my mom. So I know how to check her blood pressure, sugar levels, and it has been very much convenient for me, because first thing, I don't spend a lot, like also my time. So I'm very comfortable about it. Mom, nataka umeze dawa. Nasi amesema umeze dawa.
Asimeze.
Kato milikati. Pala kumeza fala zuru kabisa. Umeleta wewe?
Good morning. Kwaje? Uko warembo?
Yes.
How are you?
Good morning.
So kuna calendar zako.
Everything is ready.
Everything is
The
ready.
air filter is checked.
Yeah.
And also timing the limit, and we should get the patient off oxygen.
Yeah, so it's ready to go.
It's getting new, and the liters.
Okay.
Yeah.
So everything is okay.
Everything is okay, and the
What we've been doing for 5 years now is to lower the costs of healthcare for chronically ill patients and their families. And how we have been able to achieve this is by building a large network of healthcare workers and then connecting them to patients' homes so that they can provide affordable clinical and supportive care at the comfort of the patient's own home.
still at 5, so see the level of the also the level of water.
In comparison to hospitals, we are very affordable because our services, like nursing services, would cost a whole 24 hours 3,000. But when someone is admitted in hospital, an average at this point is 7,000 to 15,000 per day, and that is on the lower side. So this is really affordable for patients, and we also understand that it's not exactly sustainable for other families who live in under $1 a day. So we have introduced a service that is training of family caregivers, so that especially in rural Kenya, we train family caregivers who can offer supportive care to their patients, and then we only come in for clinical care, and this would cost them 500 per day for clinical care.
if you compare the hospital stay and home-based care, one, economic-wise, home-based is cheaper than the hospital stay, because you find that a patient is admitted in the city and the relatives are coming from the rural. The patient is faced by bills in the hospital. The relatives have to pay for hotel stay in the city. Home-based patients do not have to incur bed charges, nursing charges. They'll only pay for the healthcare assistant charges at home and only for medication. And the patients will also have a chance to interact with their relatives while at home.
Unachukua kidole hii, unaingiza hivyo, then unawasha, hii ni memory najua hivyo. Unawasha hivyo, unaifinyilia kidogo then ingie hivyo.
Oh, okay.